Dr. Rigel, could you talk about some of the concerns when it comes to melanoma in women, maybe starting with tanning beds?
Well, there's some issues that are specific in terms of melanoma risk in women, and probably foremost of that is the use of tanning beds. When you look at the data on tanning, it's about 7 times more likely that young women versus young men will have gone to a tanning bed. And if you look at the new data on melanoma incidence, for the first time, we are seeing increased incidence in young women, women in their 20s and early 30s. And the only thing they appear to be doing differently than young men is going to tanning beds. So again, we're starting to see the results of tanning beds. There's that latency of 5, 10, or 20 or more years from the time you do the damage till you see it. The high density of tanning beds have been out long enough now, we're starting to see that effect. Education is critical. When we talk about incidence rising in women, and particularly young women, incidence is related to protective behaviors. So wearing protective clothing, avoiding the midday sun, and equally important, avoiding tanning beds. I don't like to call them tanning beds because that sounds good. I call them tanning coffins. Then it doesn't sound so good. But the reality is we have to educate our patients not to do that. So that's number one. Number two is we have to get legislation out there protecting minors. Last year, 40% of women ages 17 and 18 went to a tanning salon at least once. 1 million Americans go to a tanning salon every day. There's no reason for that, especially minors. A number of the states have now enacted legislation. A number of states have the legislation pending. There is also federal legislation pending in Congress, co-sponsored by Carolyn Maloney, a Democrat, and Congressman Dent from Pennsylvania, Republican. So it's bipartisan to nationally ban tanning for minors. And we need to get support for this bill and hopefully get it passed.
So what is the future when it comes to tanning beds, and what do you hope to see?
Well, in a perfect world, I'd like to get rid of them because the reality is, especially in an era when we're concerned about health care costs, tanning beds lead to skin cancer. There's a number of studies out there that show that increased rates of skin cancer directly results from the use of tanning, both melanoma and non-melanoma skin cancer. So if we could get rid of them, that would be great. But if we can't, they really need to be restricted and regulated. And on the other side of it, we need to educate the public about the risks of it. It's very analogous to cigarette smoking. All we can do is get the word out there and hope people do less to themselves. I mean, really, it causes cancer. Why would you want to do that to yourself? And if you're not concerned about that, it also ages your skin faster too. We as dermatologists can make a difference. We have that teachable moment with our patients, and if we take advantage of that, we can make a big impact on this problem.